One of the unique things about iCare is it's designed by physicians for physicians. We have a very active medical advisory board who works closely with our medical director to make sure we prioritize development effectively and we deliver tools that are easy to embrace.
What iCare is doing is it's putting the power of technology in the physician's hands, and they can carry the medical record wherever they go throughout the building. They can work with the system on their iPads or using their iPhone, so they can use it anywhere they are 24/7.
Being on the implementation side, it's nice to be able to see the nurses working at the nurses station, picking up a phone, calling the physician, and the physician already having the information available in front of them rather than the nurse having to get a full report. So they're able to get a clinical decision quicker since they have the information readily available.
Cases overall are more complicated, more medications, more things to follow, and that's very difficult to do without having tools. And one of the tools would be having an electronic medical record. Physician input is critical at all times, and the more frequent the input, the better outcome would be expected.
I'm often dealing with blood sugars, dosing insulin. I'm often dealing with blood thinners, a drug called Coumadin, and having blood results, having dosing right at my fingertips and being able to dose and order and review saves time, improves patient care.
Previously, we were relying entirely on verbal report from nursing staff. That almost inherently cannot be as accurate as what you can pull on the records using iCare.
Very quick access to things about that patient via iCare that I have not had in the past without that technology, without that software. So I think iCare really makes me much more aware of what's happening at any time with my patient because, again, you never know when you're going to get those calls.
We find that tools like an electronic medical record and the ability to use iCare is essential to good clinical practice.
The iCare product is enabling us to prescribe medications, for example, in a very quick, timely manner.
It helps a great deal to have that access when you can't be in the facility because people can't always be in the facilities when they would like to be. So this gives them an extra electronic set of eyes and ears.
When an issue comes up with one of our patients, it may very likely occur at a time when we're not in the building where we would have access to the record directly. So in a workplace like ours, where more often than not we are not convenient to the medical record, if it had been on paper, we now have it at our fingertips.
As soon as we're able to get the iPad application in front of them, they're 100% on board. They don't need training. They don't need additional help. They walk around and start doing their rounding.
If I get a call as the on-call provider from one of our nurses, and let's say somebody has pneumonia, for example, I can instantly, on iCare, put in all my orders, the nurse instantly gets it, and then pharmacy in turn will get those orders. So it really has facilitated physician order entry, and we're very pleased with it.
The nice thing about iCare is that it's very simple to use and can be used everywhere. I can be in the facility using it through my iPad, but I can also be at home. I can be on vacation. Someone can make a phone call and let me know, and tell me that something's going on, and I can take a quick look at what's happening, their medication lists, their vital signs, etc.
It's very user-friendly. In my role, I've had to coach along some of our providers in our group, and I found that job was very easy because the iCare was so intuitive.
iCare is a critical priority at HealthMEDX. We believe the true value of an electronic medical record is the ability to manage and coordinate care, and we see physicians as the driver of that care. So placing technology in their hands so they can make the best decisions is job one.